This is a really exciting morning for me for the content because these presentations really are building upon each other. Next, I would like to introduce to you Dr. Ginger Raya. And Dr. Raya is the Director of Physician Services at HCA, where she specializes in ambulatory operations, acquisition, and employment of healthcare providers and their practices. She is also an experienced faculty and a course developer in healthcare administration for over the past 11 years. She has her bachelor's degree in organizational communication, a master's in public administration, and she also holds a master's in healthcare administration as well as a doctorate of education in organizational leadership. She was competitively selected and is a graduate of the Leadership Texas, a nonprofit social enterprise that is nationally recognized. She was also selected to participate in Leadership America in the 2020 and 2021 cohort. At present, she was elected to the board of directors for the American College of Healthcare Executives, Southwest Healthcare Executives Association chapter. And Dr. Raya also previously served as vice chair of the board of directors for KCOS TV, which is El Paso's public broadcasting station. Dr. Raya, welcome.
Good morning. Hi, everybody. Let me share my screen. So before we get started, I just want to say hello to everybody. I want to make sure everybody's awake. At the bottom of your Zoom, there's a little reaction button. Give me a reaction button if you're awake and you're ready to learn more about EI. Great. I'm starting to see that. All right, so the other reason I kind of wanted to see if you're awake is because I definitely wanted to ask some questions as we're going through this. I want to make sure that I'm addressing, your needs correctly and appropriately as we're going through this. But go ahead and give me a reaction if you feel like you are well versed at emotional intelligence at this point. Anyone? Maybe I can't see them on my screen now that I'm presenting. All right, so I'm going to talk about 3 reasons why emotional intelligence is essential in healthcare. And they're very big reasons. There's a variety of research out there that shows the business, the patient care implications of what happens when we do not foster and help grow EI within our workforce and in our healthcare environment. So I do want to talk about that. All right, let's see. So this is about me. You just essentially heard the same thing, but I wanted to learn again more about what your impression is of emotional intelligence. Whoops. So I certainly don't want to read all of this to you all, but essentially EI is how you react to situations, right? We unfortunately all know individuals who either react badly in certain situations, right? Maybe they make just a regular workday become very stressful just because, some of the ways that you see people react badly at work, especially in healthcare, is, you may see someone, yelling at people or making demands and of course, healthcare is extremely stressful. So we all know that if anyone was going to have a reaction, an emotional reaction, healthcare would certainly be the place where that could happen, right? So there's some of the historical references to kind of how EI gets identified, how EI becomes popularized. And when I first started studying emotional intelligence, this is back in 2010 when I was working on my dissertation, I really was surprised at how often people viewed emotional intelligence as purely a soft like a soft theory, like a soft skill, but it really wasn't. And if you can, understand and explain why EI has these vast implications, it's going to be helpful for you in the environment, right? So why does EI matter? So I've identified 3 reasons, and these are business, patient related, for healthcare, why EI matters in healthcare. So the first reason is talent retention. We all know, all of us are in healthcare, we all know how hard it is. I happen to live in an area where we are extremely underserved. It is impossible, for us to secure specialists, physicians, nurses. We are constantly competing with, our local competitor for talent, paying somebody, $5 more, surgical techs, like you name it. It is so hard to find talent. And then when you find it, we want to be able to retain it, right? We want to be able to hold on to that talent. So obviously the talent shortage is real in healthcare. Sorry, I'm hearing a lot of buttons. So the potential for dissatisfaction is obviously greater in environments that lack emotionally intelligent stakeholders. I can tell you that I've seen various leaders within a hospital, if they display low levels of EI, you want to talk about nursing directors, surgical techs, like, waiting out that year or that sign-on bonus, and then they leave. And we all know that it is extremely expensive to have to source, recruit, train, hire new individuals. It is extremely cumbersome for the existing staff, to take on more work, to take on more shifts, to take on. So having an environment with poor emotional intelligence, having leaders who do not display high levels of emotional intelligence is really bad for business, right? It's bad for morale. It's bad for everybody. So in healthcare, it's so important that we do make emotional intelligence a focus and have that be kind of front and center. Some of the other research that we all kind of see is that physicians and clinicians who have higher levels of EI are also less likely to burn out. They demonstrate higher levels of job satisfaction. And so when we think about that, and if y'all have questions, please chat them to me and we'll talk about it at the end. But when we think about that, why would that be, right? Why does EI equate to being less burned out? Why does EI equate to having higher levels of job satisfaction? And a lot of that has to do with, again, the ability to recognize your own emotions, to communicate them effectively and efficiently, not to become upset or angry, to understand, to say, like, I know I'm tired. I better not send these emails out right now. I know I'm, whatever it is, that you have that ability to self-assess and really to self-manage. All right. So reason number 2, which one could argue is probably the most important reason in healthcare why emotional intelligence is so important, is because the research shows us that when we work in emotionally intelligent environments, we become high functioning, and the focus really does then shift to the patient. And what I mean by that is that, again, when we have physicians, when we have clinicians, when we have nurses who practice high levels of EI, they display certain skill sets that patients respond to, that patients enjoy, that patients become receptive to. And things like listening skills, responding to patients' emotions, having respect for individuals. When I think about these factors as being related to emotional intelligence, this reminds me of bedside manner, right? We frequently hear like, oh my, like this clinician is amazing. Like they've got great bedside manner. And when you hear what that bedside manner actually means, to me, that's like, oh, that's emotional intelligence, right? These clinicians, understand the importance of the perception of their reaction, right? Are they, when they go into a room to see a patient, are they only typing in the electronic medical record? Are they making eye contact, right? all of these things translate to the patient. And especially in my environment where we have a huge need for access to healthcare, I'm sure in all environments, that these patients have a choice, right? And if you can read them, if you can, oftentimes patients go in because something's wrong, right? They don't feel good. Maybe they've gotten some poor test result back or something. Like, they already have a level of anxiety. If we can foster emotional intelligence as a trait within our clinicians, within our staff, to recognize when our patients are anxious, to recognize, like, okay, so, this is more than just, a checkup. Like, they're nervous. If you can read that and you respond accordingly, your patient satisfaction will go through the roof. And I realize that patient satisfaction has a varying scale, right? Is it outcomes? Is it perception of outcomes? Is it, there's a wide scale of things there that we have to consider. But emotional intelligence really does help to foster that experience for the patient, and ultimately they become more satisfied. And so kind of the final point on this slide is that when we have this environment where patients feel like they're listened to, where they feel respected, the research shows that they also become more active in their own healthcare. And this part is essential, right? When we're talking about healthcare outcomes for patients, moving the needle for population health. If you don't have engaged patients, how are you going to do that? How are we going to, that's another topic, I know, but having that emotional intelligence environment really and truly does help the patient, and helps them to be more engaged, and helps them to participate in their health outcomes. All right. Reason number 3. So, and this one is more like the business argument, right? Why should we care about healthcare? Emotional intelligence in healthcare. And in my mind, this point was more for like our administrators, our leaders, our COOs who may be cautious and maybe not interested in investing in emotional intelligence, in trying to foster the outcomes of emotional intelligence. Is that if you have a highly emotionally intelligent population of clinicians, of staff, of workers, the research has also shown that you can improve their EI, and thus that decreases their health expenditures. Health expenditures. And, when I first came across this concept, I was like, connect the dots. Like, how do you do that? Like, how does EI help improve or decrease health expenditures? And the reason for me that this concept was so important is that even though the research shows that you can decrease it by 1%, when you're speaking to an administrator about decreasing expenditures by 1%, that's a lot, and if you manage the business of healthcare, I manage a $60 million budget in my day job. So a 1% decrease in expenditures is huge. So how do we make that connection, right? We know through so much research the benefits of EI. We know that psychologically, emotionally, mentally, health-wise, EI helps to make you more aware of situations. It gives you that ability to self-manage. And so if we're enforcing an emotionally intelligent workforce, expenditures should also decrease. And, I was thinking about examples of this. I do acquisitions in my day job, right? I do physician acquisitions. And I cannot tell you how many clinics I've gone on into where, you're kind of going through the exam rooms and there's $20,000, $30,000 of medical devices, expired medical devices sitting inside somebody's clinic, right? And so if we're thinking about emotional intelligence and how that translates to expenditures, if you've got an angry stakeholder that is saying, I need these really expensive devices on hand because I cannot afford to not have them when I need them. Like, I get that logic. I get the implications of that. But someone who's emotionally intelligent has the capacity to kind of reflect on that and say, okay, this is this is how we're going to approach the argument. Yes, we need to have enough on hand, but a surplus of something that expensive that has an expiration date doesn't make a lot of sense, right? And so at that point, you have the ability to go back and kind of argue your case. And again, I see examples of this over and over and over in acquisition, where somebody was just reacting to, oh, we ran out of these devices, I'm going to make sure we always have them, right? And having way too much on file and then creating waste on hand. So that's an example of how we decrease expenditures, and how if you opt to foster emotional intelligence in your workforce, we can get there. And I'm going to talk about training more towards the end in regards to the conclusion. So just stick with me. The other reason, when we think about expenditures, and especially in the United States, we're constantly hearing about the GDP. This probably is now really outdated statistics, right? In 4.6% of our GDP in the United States is related to healthcare. And back in 2018, that was about 3.6 trillion, and this was pre-COVID. So I can't imagine how much that number is likely to have changed. And back then, the projection was that we would hit 6.2 trillion by 2028. So it'll be interesting to see how expenditures and healthcare expenses impact the GDP going forward. All right. All right, so now I want to talk a little bit about some outcomes, and then at the end I will talk a little bit more about the conclusion and about the need for EI training and what that specifically means. Because a lot of times when you talk about emotional intelligence training, especially administrators, sometimes have a hard time grappling how you get from A to C with that. So healthcare is so important to all of us, right? We all need it, but EI is frequently not a point of focus when we're training clinicians. Over and over, we see that. I can tell you, I work with medical students, I work with residents, and over, there's this lack of emotional intelligence training. There's a lack of just even, business training, right? And to me, EI really is a part of business training. So we want to make sure that we're vetting out emotional abilities training, just like anything else, right? If you, I'm going to steal my own thunder. Let me keep going. So there are a variety of ways that we kind of address EI. Many of us in the workforce are subjected to different personality type assessments, right? Emotional intelligence is not necessarily a personality assessment. So like at work, I've gone through things like true colors, and like we're trying to put people in a bucket to understand their personality, how they function in business, and part of the benefit of that is just in knowing the type of person that you're dealing with in business, right? There's a value in knowing, how you scale on something like a personality index, and the same thing can be said for emotional intelligence. It's important for us to understand the scale in which we are functioning and the scale in which we kind of approach our next business step. My final point on this slide is just that, again, if EI is lacking in curriculum for clinicians, EI is absolutely lacking in curriculum for things like continuing medical education, right? So we spend about $2 billion annually on continuing medical education expenditures, yet EI is just not a hot topic. It's, in my opinion, still not have that force to be reckoned with. It's still, people don't understand the business implications, the patient applications, the patient outcome implications. And so it continues to fall behind. And I definitely think that more attention needs to be paid to emotional intelligence in our curriculum and in our curriculum development. Okay, conceptually, the next outcome that I want to talk about is the idea of how when you merge emotional intelligence with mindfulness training, you really also do have a good outcome. We will frequently see that, again, if EI is lacking in curriculum, mindfulness, the concept of mindfulness is also lacking. And when you think about mindfulness, to me, this very much mirrors something like an exercise in meditation, right? Where you are observing in a non-judgmental way your own personal thoughts and your own feelings, right? And so how do we combine the idea that mindfulness is part of emotional intelligence? The last point on this slide is really that the importance of needing to focus on this curriculum, on this development for not only our business leaders in healthcare, but for our clinicians. And I think Dr. Clark mentioned earlier the concept of burnout, right? We continue to see with our clinicians that burnout is real. Very often we see that we have this increase in public mistrust of physicians, of data. Statistically, we see that 300 or 400 physicians commit suicide a year. Why? Why is that? And we know on a surface level why that happens, but how can we utilize EI to create more of that openness, that self-awareness, that, recognizing it being okay for you to utilize EI in work. All right. So now I'm closer to my conclusion and going very fast. So EI, I will compare this to something like, what happens when we have patients that are sick and that don't understand what's going on. EI very much is something that we can train our workforce to do. So the first step is always understanding what emotional intelligence is. I feel like that is half the battle. Frequently, people don't understand what emotional intelligence is, right? They think it's a soft skill. They think it's something that you can just just smile, right? Be nice. That's not emotional intelligence. So I think the first component of training for emotional intelligence is, in fact, that we do have to ensure that everyone understands what EI is, right? That there's some type of breakdown in the course and in curriculum that people really understand what that means. And I've noted the main constructs of emotional intelligence, which self-awareness, self-management, social awareness, relationship management. And I think when our clinicians, our workforces understand what EI means, that then at that point we can begin to attempt to move forward in training our workforces. So the second step in training would be in measuring your own individual EI score. And so understanding EI, understanding what your score is extremely helpful, because at that point, again, often we don't realize that we're not being emotionally intelligent. We don't realize that we're not being self-aware, or we're being self-aware in the lens of our own minds instead of how people are reacting to the things that we're saying, the things that we're doing, right? So that measurement is key, because if someone doesn't realize that they have poor EI, they're going to see it on paper, and they're going to see where they are deficient on paper. And that is absolutely going to help, in my opinion, individuals that are greatly lacking in emotional intelligence, right? So step one, understand. Step two, measure, right? That at that point you understand where you are lacking. And the third construct would be that, or the third component of training, creating emotional intelligence training, is that once you understand where you're lacking, and if we're talking about a healthcare system, if we're talking about a company, if we're talking about a clinic, and you can gauge in your workforce where individuals are lacking. If you have a leader who lacks in self-management, they absolutely need training to understand that they're lacking it, to understand the steps that they need to ensure that they can correct it, that they can practice what self-management means. And again, that example of, are you snapping? Are you yelling at people? Are you behaving, badly at work? And so there's ample ways that you can create training then to address deficiencies within your workforce so that you can move forward. And again, I wanted to cover the three areas, which again are talent retention, turnover, patient satisfaction, and the decrease in expenditures, for the reason that when we think about healthcare, that really does hit all of us, right? At that point, you could take the emotional intelligence argument to, your CFO and say, look, we could decrease expenditures by 1% of, my $60 million budget. And this is how, and these are the steps we can take. We can increase patient satisfaction. We can increase patient outcomes if we focus on training our workforce to be more emotionally intelligent. So really, my whole point in all of this is that emotional intelligence is a good investment in the future of healthcare. It's important for our healthcare workers. It's important for our patients. It's important for our patient outcomes, which we're all extremely interested in. And I hope that I've, convinced you of the value of emotional intelligence and how you can use it to better improve your outcomes at work. So I know I'm a little early. I will pause now for questions, and I've put in all my social media plugs there. Feel free to connect with me after this. I would love to connect with you.